All right, doing a quick room scan. All right. And over on my desk, I just have my necessities and nothing written on the paper. All right, so check my camera here. All right, and we'll get started. Hi, my name is Kate. I'm a student nurse here at Southwest Tech. I'll be working with you today. I'm going to draw the curtain for privacy, performing hand hygiene. Could I just get your name and date of birth, please?
Emily May, 32300.
Okay, and I'm gonna check that on your ID band. And do you have any allergies?
No.
Okay, and that is confirmed with the allergy band. Okay, and it looks like, in checking the doctor's orders here, we just have you in for a head to toe assessment today. So we'll be going over basically every part of your body and doing some movements and listening. Do you have any questions or concerns about that?
No.
Okay, and are you in any pain today?
No.
Okay, and if she was in pain, we would go through old carts, which is onset, location, duration, characteristics, aggravating factors, relieving factors, treatment, and severity. And then can you tell me your name again?
Emily May.
Okay, and do you know where you are?
Southwest Tech.
Do you know why you're here?
Skills class.
Okay, and do you know approximately what time of day it is?
Noon.
Okay. All right, very good. Her mood and behavior seem very good. It's a good affect. She's dressed appropriately for the weather. Could I just have you smile for me? Okay, and expression is good. So we're good with that. I'm just going to have you stand up for a moment. I'm just going to check your posterior posture here, checking for lordosis, kyphosis, or scoliosis. None of that is present, and you can have a seat. I've got my necessary equipment here, so I'm just going to cleanse that real quick. Clean my pen line. I'm a stethoscope. Okay. Clean my blood pressure cuff here. All right, and just a couple questions for you, Emily, before we begin. When was the last time you were in for a physical?
March of last year.
Okay, and have you had any new surgeries or procedures since then?
No.
And have you started any new medications at all this year?
No.
Okay, all right, so that's all very good. So we are going to start with a skin assessment. So just taking a look at the skin here, just checking for, temperature is good. It's nice and warm. It's a nice, healthy, light tan. I'm going to take your socks off here. No, you're okay. You're okay. You're okay. All right, so the texture is good, the temperature is good, just checking for turgor and immediate return on both the hands and the feet. I'm going to check her nails for contour and color and shape. The nails are a good color. They're nice and healthy pink. There's a slight rounded contour to them, which is normal, but no signs of clubbing. While I'm here, I'm going to check her capillary refill. Very good on the hands and the feet. It's immediate. Okay. All right. So skin all looks good. I would check for lesions, rashes, and bruising. Don't notice any on the hands, legs, feet, arms. Just check the neck area here and a little on your back. Okay, no lesions, rashes, or bruising. Lesions, we would check the ABCDE, which is asymmetry, border, color, diameter, and evolving. So that is all good. Skin looks fine. So we will move on to the head assessment, checking her head for shape, size, symmetry, and color. Everything looks good there. If I could just have you smile again. Sorry. Okay, so expression is good. Her smile is symmetrical and normal shape. I am going to palpate here, checking for any masses. Any tenderness with any of that?
No.
Okay, so head looks good. Did the skin. All right, so we will move on to, oh, I'm sorry, before we begin, we already checked for pain, but let's check, do you need to urinate at all?
No.
Okay, all right, and Do you need, you have your glasses on? Do you need any hearing aids or other equipment?
No.
Okay, all right, so we are good to go ahead and begin. So, if you want to remove your glasses, we can set them here while I do your eye exam. Thank you. You're good. All right, I am gonna grab a pair of gloves here. As far as PPE or protective equipment, I didn't need any for the first part of the exam. I will need them later on during the mouth exam. So starting with the eyes, I'm gonna check the iris and the pupils for color, shape, size, and symmetry. The pupils and the iris are all normal and healthy. If I could have you just pull your lids down like that. Okay, checking the conjunctiva, that looks good. Color and moisture. I'm going to check the sclera here. If you could just look forward. Okay, checking for lesions and color on the sclera, and that looks good. Sclera is white and no lesions, no broken blood vessels. If I could have you just close your eyelids, checking for lid lag, lesions, or edema, and that all looks good and healthy. I am just going to palpate around your ocular globes. Any tenderness with that at all?
No.
No? Okay. I am going to dim the lights here. All right, and if you just want to look forward, I'm just going to shine the light in, checking for pupillary reaction, and that looks good. Pupils are equal, round, and reactive to light. All right, and so now I'm going to check her pupillary accommodation. If you could just watch the tip of this pen light with just your eyes and keep your head still. All right, very good. Pupillary accommodation is appropriate. And now I'm going to check the 6 cardinal gazes. So again, if you could just watch the tip with just your eyes and not move your head, follow the pen light. All right, and the cardinal gazes are very good. And we'll check your near vision. So if I could just have you read the top line there.
Drug facts.
Okay, so your vision is good there. All right, so I think we've got everything with the eyes. We will move on to the ears. If I could just have you tuck your hair back behind your ears. I'm going to check the external surface of the ears, checking for color, size, shape, checking the skin integrity, looks good, checking for any foreign objects or cerumen externally. That all looks good. All right, I'm going to fold both of the pinna forward, push on the tragus and the mastoid process. Any tenderness with any of that there?
Mhm.
All right. So we are going to check the internal structure of your ears. For an adult for this, I would pull the pinna up and back. For a child, I would pull the pinna down and back. I'm checking for foreign objects, cerumen. I'm checking for color and characteristics of the tympanic membrane, and checking the to see if it's flat, bulging, or retracted. So I'll pull this up and back. All right. Mild amount of cerumen. The tympanic membrane is, sorry about that, is flat and a nice pearly gray. And same thing on the other ear. All right. Again, tympanic membrane is a nice pearly gray. No signs of redness or inflammation. No signs of retraction or bulging. It is flat. While I'm here, I apologize. I completely forgot to take your vital signs earlier. So we will get your vital signs here. So checking the blood pressure first. All right, perfect. And this wraps around 80 to 100%. And this is a good size blood pressure cuff for her. Oh my goodness, I'm sorry. using the diaphragm. One oh two over 76. That's that. Okay, and my blood pressure ranges. A normal blood pressure is, we'll do systolic first and then diastolic. So, under 120 over under 80 is normal. 120 to 129 is, 120 to 129 over less than 80 is, elevated. 130 to 139 over 80 to 89 is stage 1 hypertension. Stage 2 hypertension would be over 140 and then over 90, and a hypertensive crisis would be over 180 over more than 120. So my blood pressure ranges. We'll get your temperature quick. And slip this under your tongue. Thank you. All right, 98.5. So that is perfectly normal and healthy. And I'll do your pulse and respiration again quick. Respirations are 16 and your pulse was 60 and the pulse was regular rhythm. So those all look really good. All right, so back to everything else. I apologize. So we're gonna go back on to the nose now, looking at the external structure of the nose for shape, size, symmetry, color, looking for any drainage. Everything looks normal with the nose. I don't see any signs of deformities. If you could just lift the tip of your nose a little bit. All right. Looks good. Checking the nasal cavity, I don't see any polyps, no drainage. The color is a healthy pink. There's no deviations. The tissue looks good and healthy in the nose. And I'm just going to feel around on your sinuses. So just checking maxillary and frontal sinuses. Any tenderness with any of that?
No.
Okay, and nothing feels abnormal there, so
Mhm.
everything is good with the nose. Onto the mouth, I am inspecting the lips, checking for color, moisture, looking for any cracks or lesions. Her mouth looks good. And if you could just open your mouth and stick out your tongue for me. All right, the tongue looks good. Color and moisture are good. It's a nice healthy pink and moist. If you could just kind of lower your lip and the upper lip, checking the gums for bleeding, edema, retraction, color and moisture, and that all looks good. And if you could just take a finger and kind of pull your cheek up to the side and the other one, looking for color and moisture in the buccal mucosa, that all looks good. Just gotta grab a pen buzzer, which I don't have. Okay, we're gonna pretend I have a tongue depressor. I'm sorry, there's none in our room. If you could just stick your tongue out again, and I would tongue depress and say ah. Okay, that all looks great. So the uvula is freely moving. There's no swelling of the tonsils and no exudate noted. Her hard and soft palates are intact. If I were going to palpate that on an adult with a gloved index finger, I would press against the roof of the mouth behind the teeth for the hard palate and slide it back further for the soft palate. On a neonate, I would do the same thing only with a gloved pinky. Again, checking for intactness of the buccal mucosa. If I were going to check the gag reflex, I would move the tongue depressor further back towards the back of the throat to check the gag reflex. And that all looks good. One thing I forgot to do with hearing, I just have to check your hearing. I'm going to do a whisper test. So I'm going to say whisper 3 words behind each ear. If you could just repeat them. So
1, 2, 3. A, B, C.
okay, so hearing is very good. Can't remember if I did this, so I'll have you do it again. If you could just read the top line here.
Drug back.
All right, so near vision is good. All right, we did the mouth, and now I'm going to move on to the neck. I'm just going to check the neck for symmetry. That looks good. And then if you could just do a head circle for me. Range of motion in the neck is good. And I'm going to check one at a time the carotid arteries. Okay, looks good there. And I'm going to use the bell and listen for any bruits on the carotids. Okay. No bruits noted there. And if you could just look to the left and to the right, just checking for any jugular vein distension. There is none there. And now I am going to check all of her lymph nodes. Sorry. So we're going to do preauricular in front of the ear, posterior auricular behind the ear. We're going to do occipital at the base of the skull. And we're going to do tonsillar and that's submandibular, submental below the chin. We're going to do superficial anterior cervical. All right, and if you could turn to the left, checking deep cervical now. And to the right, again, deep cervical. Okay, and forward, and we're gonna do posterior cervical. Okay, and then we're gonna do the supraclavicular, so just along the top of her clavicle here. Any tenderness with any of that?
No.
Nope. All right, and I didn't feel any swollen lymph nodes, so it looks like that is all good. So from the neck, we are going to move on to your respiratory. Watching you breathe, just checking the rate and rhythm. Again, her respirations were 16. The rate and rhythm are normal. I don't see any use of accessory muscles, no extra effort in her breathing, so that is healthy. If I could just get you to stand up and then maybe could you remove the sweatshirt? Sorry to freeze you out. Trying to warm up my hands here. All right, I'm going to place my hands just below your rib cage and I'm going to have you take a deep breath in and out and just checking there for her pulmonary excursion, and that was equal bilaterally. And then I'm going to place my hands on your back, and every time you feel them, if you could say the words 99.
99. 99. 99.
Okay, very good there. That was checking for tactile fremitus. The vibrations are felt equal bilaterally. And now I'm just going to listen to all of your breath sounds. If you could turn around and face me, we're going to check 10 in the front, and you can just take a deep breath every time you feel the stethoscope. 1, 2, 3, 4, 5, 6, 7, And this one, 10. Okay, and then turn around and we'll do the 12 on the back. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And then I just have 6 on the sides here. If you could lift your arms. Okay, we're gonna do the bronchial. Very good. Oops. And the bronchovesicular. Okay, and the vesicular. Okay. All right. That all sounds very good. Thank you much. You can have a seat if you'd like. All right. And actually, if you want to lay down, we're gonna do your cardiovascular next. Okay, so in checking first for her cardiac assessment, I'm going to inspect the precordium, just looking for any wounds, deformities, or scars. There are none noted, and now I'm just gonna palpate, checking for any lifts, heaves. Is there any tenderness with any of that? Okay. Don't notice anything out of the ordinary there. And now using the diaphragm, I'm going to listen to her cardiac sounds. All right, so we're going to do the aortic, the pulmonic, Herb's point, the tricuspid, okay, and the mitral. And while I'm here at the mitral, I am going to listen to her apical pulse. I would listen for 60 seconds, but for the sake of time here, I'm going to listen for 30. Okay, and that sounded great. And her apical pulse was at 62. The rate and rhythm are normal. It's a healthy pulse. So for the rest of the cardiac, I already checked her capillary refill. I'm going to check here for, sorry, you're okay. Any signs of edema? There is no signs of edema or edema scale. +1 is a 2 millimeter with a 15 to 30 second, with an immediate return. A +2 is 4 millimeters with 15 to 30 second return. Okay, a +3 is 6 millimeters with a 1 to 2 minute return, and a +4 is 8 millimeters with a 2 to 3 minute return. I'm going to now check all of her peripheral pulses. We already checked the carotid, so I'm going to start here with the temporal. We did the carotid. I would do the brachial, then the radial, and we would do the femoral, which is between the pubic symphysis and the anterior superior iliac spine. I'll get the popliteals. All right, and then the posterior tibialis. All right, and if you could flex your feet toward the ceiling, and that is the dorsalis pedis, right inside of the great toe. So the pulses were all equal and normal. All right, and then we're gonna check for movement and sensation. Can you just wiggle your fingers and toes? All right, and can you feel this?
Yes.
And this?
Heck yeah.
Okay. All right, so that all looks good with the cardiac. So we will move on to the abdominal. I'm just gonna slide this pillow between the legs. All right, and we're gonna visually inspect the abdomen, checking for movement, striae, any scarring, any abnormalities, symmetry, everything, her color. That all looks good on the abdomen, and then we are going to auscultate, just checking for vowel sounds with the diaphragm, starting in the right lower quadrant, going to the right upper, over to the left upper, and the left lower. Vowel sounds are normal and active in all four quadrants. Then using the bell, I'm going to listen to the vascular sounds, starting with the aortic, listening for any bruits, going to the renal on the left side, renal on the right side, and the iliac, on the right side, and the iliac on the left side. And there's no bruits heard with any of that. So now I'm going to palpate the abdomen in all four quadrants. I'm checking for surface characteristics, any masses, tenderness, and a bladder distension. Not feeling any masses. There's no bladder distension. Any tenderness with any of that?
No.
Okay. All right, so that completes our abdominal assessment. If you want, you can sit back up and you can put that sweatshirt back on if you're freezing. Cool sweat. Okay, so the next thing we are going to do is we are going to do your joints. So I'm going to start with your head and kind of work down. So we're going to do your temporal mandibular joint. So if you could just open and close your mouth. And I'm going to feel that. Okay, very good. And then we're going to do your cervical spine. So if you could just do head down, head back, side, side, and rotate. Okay, and again, head down, head back, side to side, and rotate. All right, cervical spine feels good. And while you're sitting, we'll do your knees and your feet. So if you could just free your knees, if you can just flex and extend. All right. Okay, very good. And for the feet, we are going to dorsiflex, plantar flex, inversion, eversion, and rotate. And rotate. And now I'm just going to hold your ankles and feel that. Dorsi, plantar, inversion, eversion, rotate. All right, joints feel good there. And then if you wouldn't mind standing up. Okay, we're going to do shoulders. We're going to do flexion, extension, and then abduct, adduct, and internally rotate and externally rotate. Okay, and I'm just going to feel your shoulders while you do that. So you can flex, extend, abduct, adduct, external rotation, internal rotation. Very good. And then for your elbows, we're just going to flex, flex, extend, and then supinate and pronate. Okay, and I'm just gonna feel your elbows while you do that. Flex, extend, supinate, pronate. Very good. And then for the wrists, we'll just flex, extend, and rotate. Okay, I'll just hold your wrist. You can flex, extend, and rotate. And then for the hands, we're gonna flex, extend, abduct, and adduct. Flex, extend, abduct, adduct. Very good. So that was the fingers. And then for the rest of the spine, we're just going to flex and extend and lateral and side to side and then rotate. Okay, and I'm just going to place my hand here on your spine and you can flex, extend, and then laterals kind of side to side and rotate. All right, very good. Okay, if you want to have a seat, the joints are all freely moving, no issues with any of the joints. And then we're going to move on to the muscles. So the first one I'm going to start with is your sternocleidomastoid. So if you could just kind of turn your head side to side, perfect. And I'm going to place my hands here and have you do it again and just turn against the resistance of my hands. All right, very good. And then we're going to check your deltoid muscle. So if you could just shrug your shoulders up and down and do that against the resistance. Okay. And the trapezius, you can make like a field goal and up and down. Okay, and place my hands in the biceps, up and down. Very good. And we're going to check the biceps and triceps so you can just flex and extend. Okay, and I'm going to provide resistance. Okay, very good. And then while you're sitting, I'll do hand grips. So if you can just make a fist and then squeeze. Okay, very good. Now we'll check your hamstrings and your quadriceps while you're sitting. So again, just legs out and back. All right, and I'm going to provide resistance, checking the hammies and the quads. Very good. Okay. And then, all right, if you want to stand up, then we're just going to check the hips. And all you have to do for this is abduct on both sides. Okay, and I'm going to provide resistance. So if you can abduct and abduct and abduct and abduct. All right, very good. And while we're standing, we're just going to take a couple of steps forward. We're going to go 5 steps heel to toe. So if you go 1, 2, 3, 4, 5, checking your balance, and 1, 2, 3, 4, 5 backwards. Very good. And then while we're still here, I will have you close your eyes and put your hands out to your side. And if you can touch the tip of your finger with your, or the tip of your nose with your fingertip, one and the other. Very good. Okay. All right. And you can have a seat. I'm going to say 3 words. Blue sock bed. Can you tell me those 3 words?
Blue sock bed.
Okay. And can you tell me the name of your first pet?
Chloe.
All right. And do you remember those 3 words that I just said?
Blue sock bed.
Okay. All right. So that actually, the one thing that I did forget with your nose, I just need to have you smell something quick. If you could close your eyes with one nostril. You smell anything? Okay. And I'm sorry, it's not very pleasant. And smell. Oh. Okay, very good. So that concludes the nose. And then I forgot when I was doing your face, we're going to just do a light sensation. So if you could close your eyes again, just tell me every time you feel a touch. Yep, 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 yep. Okay, very good. All right. So that concludes everything that I have. Do you need anything before I leave? I have plenty of time.
Nope.
All right. Are you in a comfortable position there?
Yes.
Okay, great. So I'm going to gather and cleanse all of my equipment. I'm going to clean up my supplies. I will make sure that the bed is in a locked and low position. My side rails are secured. She has her bedside table and her collet are within reach. And the room is risk-free from any falls. I would notate any deviation or abnormalities per my agency policy. I'm going to document all of this in OneNote and upload it into Schoology. And I will perform hand hygiene quick before I leave the room. And with that, I am finished.